Good afternoon. I'm Julie Bentley, and I'm the Senior Program Director for Senior Services for the City of Peekskill. And I'm here with some of my associates and friends who are offering wonderful senior services in Peekskill. And we wanted to meet today to get you to know what some of their services are and to make sure that everybody knows what's available to them in the City of Peekskill. I have with us today from Westledge Nursing Home, John Paslock, who's the administrator, and his co-worker and marketing director, Giselle Malone. I'm trying not to mispronounce the names. I also have Liz Phillips here from Hudson River Healthcare, and I have Margaret Lustig, also from Hudson River Healthcare, and Pat Esposito from the Medical Rights Center. And they're here today. Each of them is going to explain to you a little bit about what's being offered in the City of Peekskill for senior services. And now I'd like to introduce you to Cynthia Knox. She is an attorney. She's a City of Peekskill resident, and she works for the Hudson Legal Services of Hudson Valley. And she's going to explain to you a little bit about the new service that she's promoting here at Senior Center. Welcome, Cynthia.
Thank you so much, Julie. It's such a pleasure to be here. And as a Peekskill resident, it is just so wonderful that Legal Services of the Hudson Valley is able to bring these services into the community. I'm going to start by just briefly discussing what we do and who we are as an organization. I don't know if you're going to be able to pick this up, Mike, on the camera, but this is a brochure that lays out the services of our organization, and hopefully you're seeing these around town in different venues. We are the largest provider of free civil legal services in the Hudson Valley. Let me repeat that. We are the largest provider of free civil legal services in the Hudson Valley. What that means is that we provide legal services to low-income individuals and families who need assistance in matters ranging from anti-eviction cases, where someone is in a non-payment proceeding or a holdover proceeding, public benefits cases, Medicaid cases, DSS cases, also known as social services or public benefits, special education cases. We have a veterans unit, an HIV/AIDS unit, and an elder law unit. I work out of the White Plains office. The White Plains office is our largest office. We have 6 offices throughout the Hudson Valley. The White Plains office covers the geographical area of Westchester County, Putnam County, and a little bit of Rockland County. So the clients of Peekskill are serviced by our White Plains office. We are also providing services in Peekskill thanks to Julie. We started providing services on site through the senior program in Peekskill a few months ago. Let me tell you specifically the kinds of legal issues that seniors face in Peekskill and other areas of Westchester County. There are the housing cases that I mentioned briefly. There's the Medicaid cases. There are consumer credit issues. Those include reverse mortgage issues. Many of you may be familiar with the term reverse mortgage, but you may not know exactly what that means. Somebody may come to your house sometimes and say they have a great idea for how you can get some money out of your house. For older people, oftentimes that's called a reverse mortgage. Sometimes that's a good thing for a senior person who can use the money using equity they've built up in their house. Unfortunately, as everyone's familiar with the foreclosure crisis, all reverse mortgages are not good for seniors. So we handle those kinds of cases for seniors. Another type of case that comes up frequently among senior clients are elder abuse cases. Now, elder abuse cases are very complex cases. People hear the term abuse and they say, abuse, that means that somebody's beating me to a pulp or hurting me really badly with some type of weapon. That's not always the case. Abuse and elder abuse takes other forms. Oftentimes, in terms of elder abuse, it can be financial abuse. Seniors oftentimes are dependent upon family members for care and for services, or even just simple companionship. And sometimes, in unfortunate situations, family members and friends can take advantage. That's not legal. There are remedies for that. So that's another area that we work with seniors. Another very important area is wills and future planning. Sometimes people say, I don't really have very much money. I don't think I need a will, but you know, it's a little nagging thought in the back of my head that I don't have a will. That's something that we can sit down and talk to you about and see whether in fact you do need a will or if you want a will. We can talk to you and say, this is what a will is and this is what a will can do for you. There are also different documents that a senior can execute with regard to health care choices. Those are very important documents for any of us at any age. Increasingly, as we age, and sometimes we can develop additional medical issues, it's very important to think about these issues when the time is right, before we get sick. Those are the other kinds of things that we can help you with. That's just a brief list. I wish that right now I could answer all your questions, but I obviously can't. So this is just a little bit of information to let you know what we can do here in Peekskill for you. We are working with Julie out of the Senior Center. Once a month we are on site. You can contact Julie if you'd like to come and meet with us at the Senior Center. If you'd like to contact us at the office, the number you can call, give you a chance to grab a pencil. The number is 1-877-574-8529. I'm going to repeat it one more time. The number is 1-877-574-8529. And the last thing I want to share with you is that we believe in Peekskill very much at Legal Services of the Hudson Valley. As Julie mentioned, I'm a Peekskill resident, and one of our goals is to open an office here in Peekskill because we know that everyone can't get down to White Plains and that it's expensive to do that. We're in the process of trying to do that. We're receiving support from Peekskill City Mayor and the Common Council and County Legislator John Testa. It's going to be a long process, but we hope that a year from now I'll be sitting here talking to you from our very own office here in Peekskill. Thanks very much, and thank you, Julie, for inviting us.
We are so thrilled to have you here. She has met with about 7 of the seniors already, including myself, because I kept putting off getting a will. Even though you think you don't have much, you know, I'm trying to get my own personal things in order. I would suggest to any of the seniors out there, if you don't have a health care proxy yet, that would be the most important thing I'm asking you to do right now, to make sure that somebody is in control if you get ill to help you that you trust. So you can call Cynthia's number that she told you, or you can also call me. The number here is 914-734-4254. 914-734-4254. And I would like to also just share with you that they do have a wonderful website for your organization, and maybe you could just mention that.
Yes, thank you for making sure that we're techie savvy here. Right. We have a website at www.lshv.org. One more time, www.lshv.org. Thanks for the reminder, Julie.
And again, please feel free to contact us. We'll try and do what we can to help you get in touch with Cynthia and get you on our schedule. And now I would like to welcome 2 representatives from Westledge Nursing Home, which is the only nursing home in the city of Peekskill. And they're got some very exciting news. This is John Paslock, who is the administrator from the nursing home, and his new marketing director, who is Giselle Malone. I'm trying not to mess up anybody's names. And I wanted to give them an opportunity. They have some very exciting news that's going on at Westledge, and I wanted to give them an opportunity for those of you seniors who may be needing their services. I know we all don't want to have to go to a nursing home, but nowadays with all the illnesses that we have, we frequently are in need of some extra help, and I wanted them to explain to you what's available to you from their organization.
Thank you, Julie. It's a pleasure being here today, and I do want to say we are Westledge Rehabilitation and Nursing Center, and I say that out in the community, and everybody knows us, but they go, where are you? And we are on Main Street, right across from the Beach Shopping Plaza and right alongside of Burger King. So those big trees that are in front of the building, those big pine trees that the original owner put up many years ago, just about 50 years ago, Julie, we will be removing some of them. So I think your neighborhood, our neighborhood, Peekskill, will be able to see all the beautiful things we're going to be doing shortly. And Julie was indicating that there's a lot of good things going on at Peekskill, in Peekskill with us in Westledge. And what it is we are renovating. And those renovations will be changing the face of our beautiful community. We have a number of services that we'll be offering as well. And I want to go through some of that with you. First, I want to say it's a pleasure to talk to all of you. And the first thing to say is, don't worry. We're not bringing you to Westledge to stay there. One of our goals is to have people have an opportunity to receive additional services because, as we all know, in the hospital setting, they have strict guidelines to do what? To get you in, get you up, get you out. And we have found, regardless of who we talk to out in the community, that a lot of times they're not ready to go home, nor do you have the services to go home. And we're able to do that for you. Obviously, it's a little bit smaller. It's not a full apartment, but it's a private room that can really make you feel comfortable. We have internet access. We have TVs, flat screen TVs, and that's even before we've renovated. So we'd love to have you here because our goal is to get you where you belong, which is back at home, and that's what everybody wants. But in case you can't, one of the things we can also do is take care of you from soup to nuts, and we want to be your family. And as an example of the family, many of our residents have been with us for many, many years. And in fact, we've had a director of nursing who was the director there, before I came, about 20 years ago. And she became a resident of ours and then enjoyed the rest of her days with us, which was, I think, a tremendous tribute to the aides that take care of everybody. They have one of the most difficult jobs in healthcare that I can think of. And everybody knows that it's not an easy job. My grandmother used to say, you know, one parent can take care of 10 kids, but 10 kids can't take care of one parent. And, you know, we want to be able to be that family for you. And I just got some great aides out there and great nursing department that have the wherewithal and the love and the passion of providing the best possible care to you. Before I go any further, I want to introduce my marketer, and then maybe she can give you an idea of what services we provide, and then I'll go back into a little bit more detail because we'd like to also give you the opportunity to see us on the website. We are on YouTube, and if you look up Westledge, you should be able to see one of the programs. There's about a 30-section section that shows what our cardiac and our pulmonary is. But Giselle, here you go.
Thank you. Thank you, Julie, for inviting us. Westledge is a 100-bed facility located in Peekskill, as John mentioned. And we've been there for a little over 50 years. Just about 50 years. We provide skilled nursing, rehabilitation, and long-term care, providing physical therapy, occupational therapy, speech therapy, as well as IV therapy, wound care, tracheotomy care, pain management, and a host of other skilled nursing services. But we're very excited about our new program, our cardiopulmonary program, where we provide telemetry right on site for our cardiac patients. And we're just really excited. It's about a year old. Mm-hmm. And we're the only skilled nursing facility in the area that provides the telemetry right on site. My job is to go around to the different hospitals in the region, and I visit new referrals. We ask for other referrals. We see our own residents who are at the hospital, just providing that customer service and making sure that they're doing well, and when we can expect them back, so we sort of keep that continuity of care going as well. And I think, John, you can explain the cardiopulmonary program a little bit more in detail.
Sure. Thank you, Giselle. Our cardiopulmonary program is headed by two people, two doctors in the local area from Hudson Valley. Dr. Abadi is our pulmonologist, and he has been with us for just about a year now, and he has devised the program so that when people who have chronic diseases, especially if it's pulmonary-related COPD and other issues, that they can provide services from the hospital to the nursing home and beyond, a treadmill, working with the pulse ox, and also obviously being on telemetry. We put the pulmonary people on telemetry as well because we want to see if maybe there's an underlying cardiac condition. And Dr. Abadi is going to be starting a program where we're going to be looking strictly at clinical outcomes. Now that we've been doing it for about a year, it's going to give us an opportunity to see what type of programs actually work, whether it's the specific ones such as the different types of exercise programs that are involved, albeit working with a respiratory therapist or an exercise physiologist, and trying to come to some links as to what works for the different groups that we deal with. As far as the cardio, we work closely with Dr. Becker and the group at Hudson Valley, obviously. They've got a brand new office, so if you haven't been there, take a peek. But it is a great place to receive services because if you've been at their outpatient clinic, the same equipment that is in the outpatient clinic is in our cardiopulmonary program. We mimicked it after them because we wanted only the best, and we know that Hudson Valley has been doing it for quite a while in their outpatient center. So one of the things that we find is, again, as Giselle was saying, the continuity of care is what really drives both programs, that people get the services in the community, whether it's in an outpatient clinic, whether it's in the hospital, and they can be guaranteed those same services at the highest skill level will be provided to them. As far as other services, Giselle has gone through them, but those two areas are, again, relatively new to this area, unique to us in this area as well. And again, I just want to repeat, we haven't given you the number yet, but being Westledge Rehab and Nursing, we are located on Main Street, right across from Beach Shopping Plaza, which everybody knows, and many of our residents go there, so they're helping the economy as well. And then we also have our number, which is 737-8400, very easy one to remember. Giselle, any other final comments?
No. Thank you very much for having us, Julie.
Thank you, Julie.
You're very welcome. Maybe you just repeat that number a little slower once more for those of us who are like me that I need to hear things 2 and 3 times.
Sorry about that. It's 737-8400. And at any time, feel free to call just if you want information or if you're looking for brochures or you just need somebody to guide you in an appropriate area, such as the Senior Center does here with Julie at the helm. She does a terrific job. Thank you for inviting us.
It was our pleasure having you here. And one last question. You do have a website as well, or no?
It's in the process.
It's in the process. Okay. So if you need help or if you need a referral, if you have somebody who is ill in the hospital and you need to know where you're going next, I'm sure that if you go over to Westledge or call them, they'll make arrangements for you to have a private tour so that you have an idea of where you're sending your loved one, and they can certainly assist you with how you're going to work finances and the care for the patient, find out what doctors are there. Having my own mom sick right now, I know how valuable your services are, and as a cardiac and pulmonary critical care nurse, I think that's wonderful that you're starting that new program, and we thank you very much for being here today.
Our pleasure.
Thanks a lot. This is Liz Phillips from the Hudson River Healthcare System and her associate, Margaret Lustig. not Marguerite. And they're here today to talk to you about the services that are being offered here in Peekskill. And I'm going to turn the mic over to them and let them give you a little background and information.
Hi, thanks so much, Julie. Well, welcome. We're here on behalf of Hudson River Healthcare, and it's affectionately known to many of you as the Health Center. We are at 1037 Main Street, right here in downtown Peekskill. And we're really fortunate. We've been here in the community for 35 years. But one of the things that people aren't so aware of is the fact that in our doors, we are offering services to families, individuals. It's what I call one-stop shopping when it comes to your primary and preventive health care needs. And our mission is to be able to serve all of those, particularly the underserved and vulnerable. But our services, there's a wide range. And so I would encourage folks to come by and to take a look. There are services that would offer you podiatry, optometry. In other words, you're able to get your feet checked, your eyes checked. We have dental. We have women and infant services. We also have dietitians, those that can assist you with your nutrition needs. And so along with that, there's a host of family practitioners and our medical doctors as well. So the health center really represents a holistic approach because it's not even just about someone's health. We don't wait for someone to have a cold. You know, we're often focusing on health and wellness programs. So there's exercise programs for the family that's run through our pediatric department. We have programs that will offer ESL classes, as well as just being able to direct people as to where they can connect. So whether you have insurance or you do not, the health center is really open for everyone. And I would just, again, invite you all to come and to take a look. So with that, I'm going to actually share this time with Margaret because she'll share with you about our presence in the community as well.
Thank you very much. I'd like to talk today about the programs that we have for seniors, since this is a senior-oriented presentation. For the past 10 years, 15 years, I should say, the Health Center has sponsored a program for seniors called WISE, which stands for Wellness Information for Senior Empowerment. I've been very fortunate to be able to be the director of that program for the last 5 years. It's an informational, recreational, and educational program. The WISE program is open to residents of Barham House and also of Bowman Towers, as well as Dunbar Heights, Turnkey, and in fact, any homeowners even in the city of Peekskill. As I said before, it stands for Wellness Information for Senior Empowerment. We meet once a week. We share a meal. We have fun. We share activities. We try to broaden our scope of information. There's so much diabetes in our community that we sometimes concentrate on information relating to diabetes, which would refer back to Elizabeth's services as a nutritionist at the health center, which is free. You can come and see a nutritionist for free at the health center to help you with any of your nutritional needs. We also have a program called HUGS, which is an intergenerational program. And that is just located at Barham House. At this point, because of insurance purposes, it's only open to residents of Barham House. And that we meet with the seniors who are interested at Barham House, as well as middle school and high school students from Peekskill. And HUGS stands for Health Unites Generations. Both groups, seniors and students, share sometimes some bad reputations of being cranky or loud or selfish. Ironically, both groups have similar needs of transportation and money. Money is sometimes limited, and transportation needs, how do I get to where I need to go, and also to find activities that are satisfying and fun. So at the end of the year, the HUGS program has a prom that we've had our 8th annual prom in June. And that the HUGS prom is open to all seniors, the seniors in Bowman Towers who are part of the WISE program, as well as seniors in the community. And we have music and dance and raffles and a lot of fun, and of course food. And we all look forward to this at the end of the year. We tried to work with Julie. Julie has many services here that we refer our seniors to. The Thursday mornings from, I believe, 10 to 1. There are experts here to help people here in the library to help people with insurance issues and senior questions. That's a valuable service. It too is free. So we're at the health center. We have doctors who specialize in gerontology. We have Spanish-speaking physicians for people who are more comfortable talking to a physician, maybe perhaps in their first language. So we would welcome everyone to come and try our program. Like I said, the program at Bowman Towers is open to everyone in the community. We meet on Thursdays from 1 to 3. My telephone number is area code 914-734-8518. That's 914-734-8518. And we'd love to see you. And if you just have a question, perhaps we can help or direct you to the right person.
Okay. Well, one of the things that we were really excited to collaborate with the Peekskill Senior Center happens to involve two things. The fact that we were working with older adults, and we were also looking at a way in which people could put life back into their life. And what that means is that we're offering what's known as Healthy Choices, and it's a program whether you are an individual who has a chronic condition or maybe you're a caregiver. And this is very unique in that this program actually allows for this group to come together. They meet for about 6 weeks, and during this time, people are able to figure out what are some of the things that they want to be able to get back to doing. So for some of us, it's a matter of just being able to regain some energy, feeling as if, you are back in control. Often chronic conditions, whether it's asthma or heart disease, people realize that there's a lot that they have in common. And so Healthy Choices allows for folks to come together. There's tremendous support. Mm-hmm. There's lots of problem solving. And people, again, figuring out how to be able to get certain tools, learning how to make goals and what we call an action plan. So while this may sound a little strange or a little foreign, what I would like to leave you with is just an invitation to at least check out the program or be able to ask for more information. Our hope is that we'll be able to come back to the Peekskill Nutrition Center. We were successful in offering this program here, and I'm sure both Margaret and Julie could comment on it. But Healthy Choices really allows people to come together and to discuss. So again, it's a small group that meets together, and there are many things that we touch upon, such as nutrition, physical activity, planning ahead, communication, how to be able to, improve your relationship with your doctor and with your family. So there's many things all of us are dealing with. So it doesn't matter whether you're the caregiver or you're the person with the chronic condition. We feel that Healthy Choices could be a program for you.
And we very much would like to offer this program. We did it once here already, and we had about 18 people, I think, graduate from it, as we called it, graduation. We did that because Margaret cooked all the food for the party that day, so they were more than willing to come. But it really was an excellent program. I'm holding up the book that we got. We each got a free edition of this, which we refer back to. I offer a health class here on Tuesdays, and we refer back to this book all the time. That was such a very positive experience for all of us. It really kind of loosened everybody up and made everybody, as you say, very much aware of how much we all had in common, no matter how serious or how minor your problem was. And it was just a really good connection feeling. So we would like to do that again. We'd like to get at least 18 people to sign up for 2.5 hours for 6 weeks. It's held at the same time. And if we get a list of people, we'll be more than glad to open the doors and have everybody come back. So if you're interested in that program, just so you can get together with other people having some of the same issues you're having, you can call me again. That's 734-4254. And I know Mike said he's going to post those numbers, so I won't repeat it. But we want to thank you very much for coming back today, and we hope you'll come back again. And there are right arms, so please make use of the Healthcare Center. And now I would like to introduce Pat Esposito, who's here from the Medicare Rights Center, who's been my right arm for the last year. She comes once a month to give us Medicare Minute updates, either she or one of her partners. And she's also very helpful in getting me any kind of information I need about Medicare problems, which I love to call people with. So I'm going to turn this over to Pat Esposito and thank her for coming.
Well, you're very, very welcome, and I'm just so glad to be here. And I tell you, as I've listened to everybody present what they are doing in Peekskill, I'm just so impressed that there is such a focus on helping seniors with their health issues. There is really a very, very strong effort, and I think we have to thank Julie for all the effort that she has put into bringing these different groups together to form a central vehicle through which seniors in Peekskill can go to. Also, often the services are disparate. They're all over the place. Here, Peekskill seniors know that they can come to one place, very often Julie's phone number and her office, and get access to such a wide variety of answers to problems they may have. We were talking before about, the central question we're now facing is, how are we going to take care of those who are old and those who are sick? I think that is really one of the central and most important questions of our time. And the way we answer that question really defines who we are. And I think in Peekskill, they are answering that question with a very, very loud voice and with such a variety of services that, for me, I'm very, very proud to be part of this program. That said, I'm with a group called Medicare Rights, which is a not-for-profit group based in New York and Washington. They sponsor a program called Westchester Seniors Out Speaking, and that is the group that I manage. We call it WSOS, and WSOS is non-political, and we do not endorse any insurance product. All we do is explain Medicare in a way that is very, very simple for seniors to understand. Medicare is very difficult. It was written by lawyers, by legislators, most of whom are lawyers, for other lawyers. And so it's very frustrating when seniors try to muddle through. They get that book every year from Social Security, and it doesn't even make bedtime reading. It makes for nightmare reading. In fact, in a recent study that was funded by a national agency, it was proven that 90% of all seniors get their Medicare choices wrong. And given that it's so hard to understand, it's easy to understand why so many are not getting it right. In fact, it's also frustrating. I like to tell a story of an elderly couple. The man needed surgery, and it was an outpatient procedure, and he goes to the hospital and he has the procedure done. And afterwards, his wife goes to see him, and the doctor is by his side, and the doctor says, "Your husband did so well, and he's going to be fine." And the woman, of course, is relieved. But then the doctor adds, "He will be going home at 5 o'clock." And the woman says, "What? I'm in my 80s. I can barely take care of myself. What if something happens to him?" And the doctor responded, "Don't worry, you'll have my cell phone. Everything will be fine." The man goes home, couple goes home, knock on wood, he did do very well. 6 months later, their beloved pup gets sick and has to have a surgical procedure, and so they take him to the vet. After the procedure, they go in to see the pet, and the doctor said, Champ did really, really well. And they're so gratified because this is like their little baby. He says, but there is one thing. I really do want to keep him overnight. So, you know, the woman says, my husband had surgery a few months ago, and they released him at 5 o'clock. You know, what's happening here? And the doctor says, oh, I'm so sorry, but your pup does not have Medicare. You know, so that little story just sort of depicts the frustration that seniors feel about Medicare. So, you know, so what we do at Westchester Seniors Out Speaking, we have a monthly program called the Medicare Minute. And what we do is we go into senior citizens around the county, and currently we are in over 42 community centers, including Peekskill, in which we go in there every month and we give them a little tidbit of information of what's new about Medicare. For instance, when the Affordable Care Act was passed, seniors were very concerned about how it was going to affect them. So for that month and for several months thereafter, we went in and we explained to them how the Affordable Care Act was going to affect Medicare and the benefits beneficiaries would receive. We do this program in conjunction with the Westchester Library System. We are partners. And what they do is they have a program called the Senior Information Benefit Center. And these centers are located in 8 libraries, including Peekskill. And we have trained counselors who have been trained by Medicare Rights solely to deal with Medicare issues. And a senior can walk in off the street and get their Medicare questions, their Medicare issues handled in a way that they can understand. This is particularly important because right now, in fact, it started yesterday, we have the Medicare open enrollment period. And that's a time when a Medicare beneficiary can take a look at their insurance that they're currently receiving and say, maybe I should make a choice. I haven't been really happy with the insurance policy I have. And the insurance policy I'm talking about right now is that policy which covers the 20% that Medicare doesn't cover, the supplemental insurance policy. So they can go in there and they can take a look and get counseled as to what their better choices are. At the Peekskill Library, we are there on Thursdays from 10 o'clock till 1. You don't need an appointment. But what you do need is a list of the drugs you are currently taking, because those drugs will determine the type of Part D insurance program you should enroll in, and that will often determine your medical, your supplemental medical insurance as well. So please, I encourage everyone who is receiving Medicare benefits to take a look and to visit the library. And if you'd like me to come to your organization and talk more in depth about Medicare or about the Affordable Care Act, I'd be pleased to do so. You can reach me at 646 888-770-7410. We also have a website where you can contact Medicare itself, and that website is medicarerights.org. They also have bilingual counselors at that website which can respond to you. In terms of Westchester Seniors Out Speaking, we are now beginning a Hispanic outreach program, and we do have bilingual counselors available. So again, if you call me, we can arrange to have a bilingual counselor help you with your Medicare issues. And Julie, I think that's about it. Anything else?
Well, I just want to thank you for coming, and I do want to just mention, if you want to be here for our Medicare Minute, it is usually on the second Tuesday at 9:30 in the morning. It usually only lasts about 15 minutes, but we usually get a lot of great information, and that is Jill DeGotti, who is one of our representatives from Medicare Rights also, who comes down to do that, and we certainly don't want to leave her out of the appreciation booth. So we want to thank all of you for your help, because that's been a great help to us here. I would be remiss not to mention we have a whole list of senior services that get done down here as part of the city senior service program. And we have a whole nutrition center upstairs where they prepare over 200 meals a day for both homebound, for Peekskill, and for Cortland. And they also serve a congregate meal here for anybody that wants to come in and have a hot lunch 5 days a week. If you were interested in finding out more information, you can contact Rhonda Getter. She's at 734-4250, and she is our outreach person. So if you need somebody who is homebound and cannot get out to get a hot meal, we'll make sure that they get one delivered Monday through Friday. There is a $3 suggested contribution, but anybody that doesn't have the $3 a day, we will still service them. We will not turn them down. So we do have a site on the city website, which is www.cityofpeekskill.com. And if you look under community, it'll list senior services, and you'll be able to see the nutrition information as well as the senior programs. We also have a senior club that meets down here 4 days a week. We could go on for hours and hours about everything going on, but I got to let Mike get out of here. I do want to thank all of my co-hosts today, and I want to thank them for everything they're doing for the Peekskill Seniors, and a special thanks to Mike Miner for doing this program.